Good afternoon. I'm Kimberly George, President and CEO of Project Guardianship. Thank you, Senator Krueger, for asking Acting Director Olson about guardianship. I'm here today to talk about New York's broken guardianship system. Article 81 of the Mental Hygiene Law states that any person or entity can petition for someone else to be appointed a guardian, and after an investigation and hearing, if a judge decides the person is unable to meet their personal or financial needs, is unable to make reasonable decisions, and is at risk of coming to harm because they do not understand their need for help, the judge must appoint a guardian. But there is nothing in place to ensure that a good guardian will be available to serve. The system relies on family and friends to do the work unpaid, or for the person needing the guardian to have money to pay a private practicing guardian. This leaves many adults who don't have family members able to take on the role, or who are aging alone and living on limited financial resources in precarious situations. In some parts of the states, nonprofits have stepped in to fill the gap, working not only to care for their guardianship clients, but also to raise the funds year after year to keep their programs going. Several have closed their doors in recent years, and those of us who are surviving don't have enough funds to meet the demand. This leaves guardianship judges struggling to find appropriate guardians. The judges report having difficulty finding a qualified guardian to serve in 1/3 of the cases they hear each and every day. In New York City, that number goes up to 1/2. Project Guardianship and a coalition called Guardianship Access New York have been raising awareness of this serious and growing crisis for a number of years now. New York needs a publicly funded guardianship program. We are very disappointed that the executive budget for fiscal year 26 did not include any funding for guardianship. We have a proposal for an annual investment of $15 million for a statewide initiative of nonprofit guardians, also called SING. SING would ensure New Yorkers who need a guardian have access to a high-quality, person-centered guardian, regardless of their financial or social circumstances. SING would build the capacity of local nonprofits across the state to serve as guardian. It would create a workforce trained to do the healthcare coordination, social work, money management, legal services, housing services, benefits applications, etc., required of good guardians. It would establish a database with demographics and outcomes of nonprofit guardianship clients. And it would result in an estimated net savings of $80 million per year in Medicaid costs by shortening hospital and nursing home stays and keeping people out of institutions and in their homes and in their communities. Our proposal is rooted in decades of practical experience and a deep understanding of what it takes to be a caring guardian for another person. Please fund SING, and if you're not convinced, please Google ProPublica Guardianship, because as Senator Krueger mentioned, there's been 10 articles in the last year focusing on the crisis. Thank you, everybody.